Hey, Amy, thank you very much for your response to our discussion this week, week 7. I appreciate your openness, your honesty, in sharing your experiences. First and foremost, no, no, you did not provide too much. That's fine. That's the purpose of the discussion. Again, keep this in mind. The discussion posts, the responses, and the interaction with your classmates, they are there to represent discussion that would occur if we were in the same room having a dialogue. So just keep that in mind. So again, I appreciate what you shared and how you shared it. I also want to recognize that what you shared, I know might have been difficult to relive and to recall. So thank you for that. And what you shared um, may have been empowering and motivating based on the experiences. So again, thank you. It's important for us to recognize and understand as we move forward in our training, not only in this course, but also in the program, that our ability to recall experiences of being marginalized helps us to become a better, more ethical, culturally responsive, professional, effective counselor. Okay. It simply does. When we're able to empathize with our client, when we're able to create space to understand their worldview, how they live, and their experiences, it educates us on how to best support them within our counseling space. Okay. So, for example, oftentimes we talk about bias, right? And when we're one that's marginalized or one that is in a privileged position, we all have bias. And that bias is with us either consciously or subconsciously. If we're not aware of it, it can negatively harm our clients. How, you may ask? If we view a particular population a certain way, we may not accurately assess and evaluate why they're coming to see us. That means a mental health diagnosis may be inaccurately placed on this particular client. Treatment plans may be inaccurately developed for this client. Interventions may be accurately identified and used on this client. That becomes a harmful resolution. So we have to be aware of that. All right, we have to be aware of that. So recognizing um, marginalization, recognizing privilege, recognizing our biases play a role in this. As we speak specifically to first responders and the military population, while we recognize and understand that these two professions, that community in itself is a different culture, right? Is a clearly different culture. We have to appreciate that even within that culture, there are individuals that are like us. There are individuals that are marginalized. There are individuals that have privilege. And it's important for us to be able to um, be present with anyone that comes to us. It's important for us to use that presence to better understand one's worldview and simply how they operate, how they think, um, how they see the world, and how the world sees them. So, again, thank you for sharing and thank you for being you. Also, I wanted to know your results after taking the self awareness, multicultural awareness assessment.